Welcome, Dr. Alex. It is such a pleasure having you on the show today. Welcome.
Thank you so much. I'm so pleased to be here, Juliana.
Yes, likewise. And usually I love to start the show by getting our guests' take on confidence. But I think for our special conversation, I would love for you to share with us your perspective on confidence from the standpoint of feeling confident in advocating for our own health, especially as we age.
Yeah, that's such a great place to start because I think eh, we often are missing that confidence when we're feeling within ourselves a better health and then trying to navigate a healthcare system or discuss health issues with healthcare providers of all kinds. And
Yeah.
so I'm a big fan of education. I think as a naturopathic doctor, one of the core concepts is doctor as teacher, and I take that to heart. And so I feel that that confidence can come from knowing more about the things that are important for us, right? And I think that's
Yeah.
true about lots of different things, not just healthcare, but if we have at least a little bit more of an understanding of why do I feel the way I feel, or what questions I can ask, not just myself what to look for, but the healthcare providers that I'm working with,
Yeah.
then all of a sudden we can actually have a conversation rather than being like a recipient of information that may not actually relate to our situation.
Yeah, that's beautiful. And I even look at myself, like, let's just say 20 years ago when I first came to Canada, because I was coming from Brazil, very different healthcare system, and even the rules of the game changed, right? And I was actually told by, somebody when I was in university that you actually can advocate for your health. You can actually disagree potentially with a care plan. And I was, before surgery, spinal surgery, going through different doctors, lots of medications and lots of different opinions, and nothing was working with like chronic pain, fatigue, migraines. So it was so interesting to me to hear that I actually had a say. And I think it really marked me as, we would assume a lot of people knew that, but I didn't, right? Back in the day. So I really love that you brought that perspective as well. So in the concept, we're going to be talking about heart health, throughout today. I know it's of course your specialty, but maybe let's start by, help educate our listeners as we age, as we women age. What are some of the changes that happens to things like blood pressure, cholesterol as part of the natural aging process?
Yeah, so if I sort of turn back the clock on that a little bit,
Yeah.
so generally speaking, women are considered to be at lower risk of heart disease. And that's true, but it's particularly true in our younger years. And it's not true for everyone, of course, but if we just take, as a population, women are at lower risk of heart disease in our earlier sort of premenopausal years because of the presence of estrogen for the most part. So actually, estrogen has a protective quality to our cardiovascular system in a number of different ways, not the least of which is in relation to blood pressure and cholesterol control.
Mm-hmm.
So as we go through that midlife time and the estrogen levels eventually decrease and decline in a more, you know, um, permanent way, those protective mechanisms start to dissipate. And it doesn't happen overnight. You don't wake up one day like in a completely different cardiovascular situation. It takes place over a period of time. And our best guess is that the bigger changes to things like blood pressure and cholesterol probably happen in and around the plus or minus 2 years of that final period, right? So
Right.
so that's a pretty it and it's important that we know that that takes place over that period of time because it can sneak up on us, right? So,
Yeah.
especially if you spent most of your life being told that your cholesterol and your blood pressure were great, that's often like, oh, it's perfect. Don't you worry about it type of thing. And
Yeah.
then it sneaks up when you're not paying attention. And then maybe, especially these days, maybe someone hasn't had medical visit or some lab work or have their blood pressure taken for quite a long time. And so after 4 or 5 years, you go in and you happen to have also gone through a menopausal transition. And then all of a sudden you're being told your blood pressure and your cholesterol are significantly high. And you think, what happened? Everything
Yes.
was fine, right? And that's it not only as a result of the estrogen piece, but it's a big, big part of how things change for us at midlife. And then our cardiovascular disease risk starts to creep up after that point in a more significant way, so that
Mm-hmm.
we reach like a similar risk as the men in our lives.
Mm-hmm.
And if we think about how women typically will outlive men, generally speaking,
Yeah.
the risk of heart disease in women is very similar over time as it is to men. It's just for us, it's sort of skewed into our later years as opposed to men where that, affects them at an earlier age.
Yeah. Thank you so much
But
for that. It's a
yeah,
beautiful overview. Mm-hmm.
yeah. And I would say one of the things about that midlife piece is that there are so many other pieces too, right? I think that most people in midlife can relate to how maybe there's impacts on sleep and there's impacts
Yeah.
on mood and energy levels and other components there. And so if we had a great exercise routine or felt really motivated from a nutrition point of view or whatever is going on, and let alone like sleeping well, and then those things start to change, then how we feel about ourselves and the lifestyle sort of steps that we take may also change, and that can also have an impact to our cholesterol, blood pressure, and cardiovascular risk. So there's a bit of a double whammy that
Yeah.
can occur at this time of life for sure.
Absolutely. And also all the, life stressors, right, that we really see to culminate in that later phase with aging parents, in some cases, teenagers,
Yeah,
all those things like at
yeah,
once, often, and also like peak of careers and so on. So I think it
yeah.
just
The
keeps,
classic sandwich generation, right?
yes,
Yeah, yeah.
exactly. And you kind of like mentioned some of the, I would say more like known risk factors, right? On top, of course, of the decline in estrogen levels. But
Mhm.
what would be some, because I've read a blog that he done some time ago that I thought was really interesting in terms of some of those hidden risk factors that women may not immediately associate with, cardiovascular health.
Yeah, and I think I know what you're alluding to, and there are things that can happen throughout our lives which are unrelated, or at least feel unrelated, but can have this later impact depending on the situation. So one of those things would be different types of cancer treatments.
Mm-hmm.
That, when the time of the cancer treatment, that is the priority for very obvious reasons.
Yeah.
But particularly when we're talking about cancers of like the chest, so, chest cancers, some of the like non-Hodgkin's lymphoma, depending on the treatment, if we've got certain types of chemotherapeutic agents or radiation that's particularly centered more towards that left side, we can have these impacts on cardiovascular health. Now, treatments have evolved over time so that this is becoming less of an issue because we've become aware of this. But for women who are entering midlife now or who are a little bit older, if they've had those sort of treatments in their 20s, 30s, or 40s, and now we're looking, 20 or 30 years down the road, the impact of those treatments on their heart health would not have necessarily shown up at that time.
Yeah.
And it's now showing up decades later, coinciding with these midlife changes.
Mm-hmm.
And it's a bit of a double whammy. So that would be on the top of my list. And so when I'm talking with women, particularly around uh, this age, we're talking about past medical history in part with an eye to talk about those cardiovascular risk factors that we don't think about so much. So
Yeah.
that's one that I feel quite strongly about. Another is in and around larger reproductive issues. So we have a variety of scenarios related, particularly to pregnancy,
Mm-hmm.
that if they happened, it's not that when it happens, it changes your heart and then something's going to happen later. But what we will often say is pregnancy is a big stress test, right?
Yeah.
And we mean that in this instance in like a cardiovascular way. So when you hear about people they go to a cardiologist or they're sent for a stress test, right? It's to
Mm-hmm.
try and estimate how the heart is able to withstand certain types of stressors. Well, pregnancy is actually a kind of stress test from a physiological perspective. There's a huge increase in like blood volume. There's just lots of cardiometabolic things that are happening that will uncover susceptibilities. So if someone develops, let's say, hypertension in pregnancy, and there's different versions of hypertension in pregnancy, but if we think about a classic like a preeclampsia,
Mm-hmm.
that will typically dissipate after the pregnancy, right? After the delivery, the blood pressure will come back down to normal. That person is at greater risk of developing issues at a later date, not because the
Mm-hmm.
preeclampsia damaged anything per se, but because it represented an uncovering as of a susceptibility,
Yeah.
right? So if someone says, "Oh yeah, I had two pregnancies, I both had, I had preeclampsia in both, but everything was fine, when the year after postpartum," we'll start monitoring her blood pressure just sort of more regularly to make sure that if there's a change, which is a bit more likely in that person, we're capturing it before it becomes too much of an issue.
Mm-hmm.
So
Yeah.
those would be two big examples. And as a result, talking about reproductive health, particularly around pregnancy and fertility, as well as sort of cancer history, are two things that I bake into my like intakes because even though a woman may be coming in to talk about her hot flashes, I'm like,
Yes.
tell me about your pregnancies. And then she's like,
Yes.
I don't think that's important. And I have to describe why that might be. Yeah.
Yeah, and I think that's really the beauty of the type of care you offer, that you're looking at the whole person, even through life stages, right? Rather
Right.
than just what the paper, if you were to do some blood work, for example, would tell you in that moment in time. And I think
Yeah.
that's really the value of the type of care, the very holistic side of naturopathic care, right?
Yeah.
I will also link to the blog post that he wrote below because it has, such wonderful information there. But one of the things that he talked about is really also chronic inflammation. And I
Mm,
love that topic. So talk to us a little bit in terms of how is chronic inflammation related as one of those hidden like risk factors for heart disease.
right. Yeah. And you catch me at a good time. I actually spoke at a conference a couple of weeks ago about um chronic inflammation and like autoimmune conditions that have
Yes.
inflammation and the risk with heart disease.
Hmm.
So inflammation is definitely an additional risk factor as it relates to heart disease. So it depends on the heart disease that we're talking about. I mean, I'm using this term very generally.
Hmm.
When I'm talking about it, however, I'm usually referring to atherosclerotic heart disease, which is the
Hmm.
development of atherosclerosis. What people will often talk about is like narrowing of the arteries or blockages, which are the most common scenarios leading to like a heart attack or a stroke. It's not the only way that all of this stuff happens, but certainly the most common and what we see most significantly worldwide. Um, the inflammation is a component of the progression of atherosclerotic disease. So it happens naturally, but if someone has scenarios where there's more inflammation than even the norm, then you can imagine how this might accelerate the progression of these scenarios. And we do see that, unfortunately. And so, using the example of autoimmune conditions that have a lot of inflammation, so like rheumatoid arthritis, for example, or lupus, two conditions that are more common in women.
Hmm.
Um, Chronic inflammation, significant chronic inflammation, those women will see greater risk of developing cardiovascular disease in over lifetime, right? And so
Yeah.
again, when we talk about the layering, if someone has been diagnosed with their rheumatoid arthritis in their late 30s, early 40s, maybe their 50s, especially if it's coming in and around that menopausal time, we have these layers of potential risk factors that it behooves us to be particularly mindful about because inflammation has that risk associated, whether it's in an autoimmune condition or not. We want to identify and try and support and reduce inflammation because of that component, because of that risk factor. So
Mhm.
it's not the I'm going to say it's not the most important piece of the cardiovascular puzzle, but that is sort of devaluing it, right? It's
Yeah.
still a really big additional factor.
Yeah, absolutely. And when it comes to genetics, I'm sure that is one of the things that, women have a lot of confusion about. Is genetic screening part of your screening process early on, or where do you see the role of actually looking at genetics in terms of prevention, but also helping you uncover what potentially could be going on?
Yeah, it's actually a fascinating question. I know it dovetails really nicely with the work that you do,
Hmm.
or your focus on genetics in a different way. Um, I guess I have two answers. So the first is I I don't often consider genetics really directly. I spend a lot of time talking about family history, though, which
Hmm.
of course
Yeah.
is a proxy for those details.
Yes.
Because most of our evidence for like it's it's easier to link through family history
Hmm.
and and less expensive and all of the things. It
Yes.
makes it a bit more accessible, right? It is a bit of a double-edged sword. The family history discussion, it's more complicated than you might think sometimes because we can see family history, someone will say, especially those of us of a certain age, will say, well, all my grandparents died of heart disease, but I'm sure it was because of the fact they were all smokers and big drinkers and um, ate a certain way and whatnot, because we did see that a lot more in certain populations, especially 50, 75 years ago, which I think, our younger uh, populations now, like people in their 20s, like their grandparents may not have had that type of history in exactly the same way,
Yeah.
right, as a group. So sometimes people will say, well, yes, of course, we had lots of that in the family. Um, but it's a bit of a red herring because, everyone was a smoker. But the fact is, you can still see these really significant lines, and not everyone that smokes has a heart attack,
Yeah.
even if it's a risk factor. So we have to be really careful about not falling into some of those traps. And I realize I'm going down the family history piece, but I actually talk family history a lot. However, through our discussions with family history, we can start to tease out some scenarios where the genetic component can be seemingly more meaningful. And there are times where that information can be really important in further and better understanding the situation. So a perfect example of that would be if I'm seeing cholesterol levels of a certain amount, and
Hmm.
I'll throw out a number out there just to kind of make it relevant in case, especially someone recognizes this number and goes, "Oh, no one's ever talked to me about that." So
Yes.
if someone has an LDL cholesterol number of 4.9 millimole per liter or higher,
Hmm.
or if you have US listeners, that would be 190 milligrams per deciliter or higher. That doesn't mean they have a genetic condition, but it makes it way, way more likely than someone who has a lower number. And we know that certain types of genetic conditions, particularly, and I'm thinking of familial hypercholesterolemia,
Hmm.
brings more risk to the table than just the cholesterol being elevated. So there's like more to the package. And so it can be really important. It can be really important to understand if that's going on. And there is
Yeah.
genetic testing for that. There are tests to do, and there are tests that come up in even commercial testing, although it's not as complete, um, that will help us assess whether that's the case or not. And so in scenarios like that, I will advocate for genetic testing specifically so we have a better sense of what's going on. But generally speaking, I'm relying on what I feel I've developed a fairly good ability to weave through family history conversations.
Absolutely. Thank you so much for that explanation. And in the staying in the lines of cholesterol, I've heard you talk about cholesterol exposure before. So tell us first of all what you mean by that, and then
Yeah.
educate us on the topic.
Yeah. So I'm glad you brought that up because that's like I'm very passionate about that. I think that everyone who works in healthcare probably has a couple of soapboxes, right?
Yes.
So this is one of mine. So cholesterol exposure it's kind of as it sounds in some ways. It relates to how long, how exposed we've been to elevations in cholesterol.
Hmm.
So if I backtrack a little bit, cholesterol is important. It's like the necessary ingredient for the development of atherosclerotic heart disease. We can't create plaques, coronary plaques, arterial plaques without the presence of elevations in cholesterol. Now, where that line is differs, and
Hmm.
the exposure to elevations in cholesterol over time increases the risk of developing plaques. So, like
Hmm.
if you have more of it around for longer, it makes sense. You'd have more capacity to make more plaques. That's kind of what that's alluding to. If I put it a totally different way, and certainly the way that I describe it to patients who have never heard about this concept before, is I sort of talk about smoking pack years. And again, I feel like this is an analogy I'm going to have to change at some point as I see younger patients more often. Vaping pack years, it doesn't
Maybe,
have the
yes.
same sound to it. I don't know. But if I have two people sitting in front of me and they each say that they're smoking a pack of cigarettes a day, I'm like, okay, like let's talk about this. And then one person says, well, I've been smoking a pack of cigarettes a day for the last week only. And the other person says, I've been smoking a pack of cigarettes a day for the last 20 years.
Yeah.
I think it's easy to understand that we're a little more concerned about the health outcomes of the person who's been smoking for 20 years
Yeah.
than the person who's been smoking for a week, even though on paper and on the surface, they're the same, right? They're both
Mm,
smoking a pack of cigarettes a day.
yeah.
So if we segue that to the cholesterol piece, if someone goes to the doctor and the doctor says, oh, it's still higher than I would like to see, but it's no panic. We'll keep watching it. And then you ask, and it's like the number's higher than we would like, but it's only been higher for a year, right? So maybe your midlife person, she's had actually really great numbers, and then it's come up just during that plus or minus 2 years that I was talking about earlier.
Hmm. Hmm.
That's a pretty recent increase, right? We have lots of opportunity to change it now, but like that's a pretty recent increase. Meanwhile, if we compare that to someone who the doctor's been saying that for the last 10 years,
Yeah.
right? Like it's higher than I would like, but we'll keep watching it with often the feeling, well, women are at lower risk, so we're not as panicked about it. Well, now we're looking at that person from a pack year, if you will. Like we're
Hmm.
looking at more of that 20-year person rather than that 1 week
Yeah.
person. That's where that comes from. And I really encourage people to take those types of scenarios more seriously, even if the health provider is not. And I will say that in research and in the circles of like it hasn't quite trickled down yet to most healthcare providers. I actually tend to be quite conservative about cholesterol. And
Hmm.
this cholesterol exposure, I guarantee you that concept is going to be talked about by everyone in years to come. But we're
Hmm.
not we're not quite there yet. It's not common. It's not a common discussion point, and I'm trying to change that single-handedly.
Yes. And this is excellent. And I think it really ties into that beginning conversation we had about, having enough empowerment in education of self so that we can actually
Yes.
advocate even before it catches on, right? So
Yes, yeah.
everybody's talking about it.
Like everyone be an early adopter about their cholesterol.
Yes, exactly. And I have one more question for you, Dr. Alex, and then we can go more into some solutions here. And this is it's not necessarily something I promote nor practice, but it's something that I see a lot on
Mhm.
the web, I guess.
In the online space, yes.
Yes, which is a lot of the keto diet
Yeah,
promoters or the ultra carb living,
right.
promoters
Yep,
that are really encouraging women to consume high levels of salt on a daily basis to
yep,
really compensate for the really low carb intake.
yep,
So talk to us about your perspective and take on it. Of course, keeping, heart health as
yep,
our main concern.
yep. So there's two big pieces to that. So there's the cholesterol piece potentially and the blood pressure piece with that conversation. And yes, that's a really relevant conversation because lots of people are looking at this and looking at it for their best health, right? So
Yeah.
people who are getting into, well, usually any dietary um, strategy are looking to feel better and be healthier. No one's doing it to be worse off, right?
Yes.
Um, so so with that in mind, what are we trying to achieve? How are we achieving it? And what trade-off are we potentially considering, right? So
Right.
that's how I start those conversations. Something like keto, well, either or the the problem, and I'm doing this, the problem is that it is difficult to achieve the macros related typically without relying a lot on more animal protein, fat sources.
Mm-hmm.
Doesn't mean that it has to be exclusive, but there's a bigger component there. It's harder to meet macros without doing that. So you can't, it's really difficult to do, say, like a vegan keto.
Yes.
Um, it just, the numbers don't work typically. So because we have and I realize in the online space you may have heard something different, but I can tell you with a lot of confidence
Mm-hmm.
that when we look at saturated fat, 9 times out of 10, a higher intake of saturated fat will increase cholesterol.
Mm-hmm.
Now, there's a lot of nuance to that conversation, but ultimately, at the end of the day, that's kind of what we're looking at.
Mm-hmm.
Similarly, high sodium intake will increase blood pressure. And there's some nuance, although not a lot, but at the end of the day, that's what we're looking at.
Mm-hmm.
So if you have a diet which has bolstered both of those. And I'm oversimplifying a little bit because there's also, decreased fiber and some of the other things that we associate with improved cardiovascular health. But if I keep it to like saturated fat and sodium, which was the first question,
Mm-hmm.
um, it is very unlikely to see a low saturated fat, low sodium, especially if you're adding a ton of salt,
Yeah.
version of keto or ultra low carb.
Mm-hmm.
And as a result, most, but not all, people who do those diets over a long period of time will see their cholesterol come up and or their blood pressure come up.
Mm-hmm.
And that has negative consequences to long-term cardiovascular health. That's as sort of simple as I can make it. Now, I understand where a lot of the arguments against that come from. It starts right from cholesterol increases don't matter, which is if if we can't agree that cholesterol increases the risk of heart disease, then the conversation is much more difficult to have, right? So,
Yes.
so we have to at least start on the same page that elevations in cholesterol and elevations in blood pressure do increase cardiovascular disease risk. If we start there, then this conversation can be had. If that's not where you sit, then this doesn't work as a conversation.
Yeah.
But setting that aside, what's really nice is that we can see those things, right? At some point, it's not best guess. No one has to guess. At some point, you either see elevations in cholesterol and blood pressure, or you don't.
Mm-hmm.
Now,
Yeah.
I don't, I'm trying to prevent that from happening in the first
Mm-hmm.
place. But at the very least, if that occurs a year, 2 years, 3 years in, 3 months in, whatever it is, if someone's monitoring, then at some point they'll catch that. And
Mm-hmm.
as long as there's an understanding that that's likely coming from those shifts in diet, and the way to change that is to change those dietary patterns, then again, we're sort of all on the same page.
Yeah.
There's always going to be people who don't see those changes, but it's a small subset. They're the exception, not the rule. And I
Mm-hmm.
think sometimes people assume that because they don't see that type of consequence in 3 months, 6 months, 8 months, that it's never going to happen.
Yeah.
Yeah.
And even like from the nuance standpoint that I mentioned, like one of the things that I do in my work through genetics is really looking at our tolerance to things such as saturated fats. And that number is a lot lower for most people than what they are typically consuming. But I'll say like a counter question to the first question. So let's just say somebody is on the very ultra low carb, like very, strict ketogenic lifestyle. If they're not supplementing with salt, like a lot of the experts are telling us to do on YouTube, do you, because of course, if we are not having the same intake of carbs or not retaining the same, amount of sodium in the body, that's their theory. Would you say that that could be a detriment to health to not be, say, cooking with salt and adding, sodium in if we are in the very low, under 20 grams of carbs per day space?
Yeah, I
Or is it
typically,
hard to tell?
yeah, I would say typically I'm not concerned about it, to be honest. And again, some of this, and I know this can be a controversial take, particularly, uh, yeah, I get it. In certain circles anyway. There's lots of research showing that low sodium is not harmful. And I realize that's what the controversial statement is going to feel like, right?
Right.
But I, as a naturopathic doctor in particular, am quite focused on the individual. I use the
Hmm.
research and our best understanding of what applies to a population to help me direct conversations with someone sitting in front of me.
Yeah.
But I don't not listen to what the person is saying because I'm over here saying, well, the research says, although I do that a lot, but it has to be woven through the person's experience and their reality, right? So
Yeah.
there are times where we will explore that within the confines of what I'm comfortable with. So, um, I actually do in those instances quite a bit of tracking, right? So we're looking at, well, where does that intake land? So
Hmm.
there's no reason, regardless of how you're getting it, if the sodium intake goes beyond a certain point, I'm just going to be very conservative and say like 2,300 milligrams,
Hmm.
it that isn't required. It doesn't
Right.
matter what's happening. So that's kind of how I go with that.
Yeah.
And again, we're not in the business of mm, if people are feeling unwell, we figure out why they're feeling unwell.
Absolutely.
Yeah.
Yeah, thank you so much for that perspective. And um, like I really feel like it's such a controversial topic, and there's such strong arguments and a lot of opinionated, personas out there. So I'm grateful that you were able to bring your perspective to us.
Yeah.
Now, in
Can
the
I
kind of
add one more thing,
yes,
Juliana?
absolutely.
As I get warmed up on that. I mean, I'll probably leave it with that. I think again, from the blood pressure specific point of view, there are two that sodium conversation is twofold, although the sodium piece is the most robust piece to that.
Hmm.
But the second piece, which actually maybe I will add a little bit more because it
Hmm.
relates to women at midlife in particular as well, um, is the potassium piece.
Yeah.
So sodium potassium are buddies, but they go in opposite directions. And so, as it relates to blood pressure specifically, so increases in sodium increase blood pressure. If we have uh, lower potassium, that makes the problem worse. So, if we look at that the other way,
Hmm.
someone with excess sodium intake or salt intake, if they decrease their salt, we can see reductions in blood pressure. That's particularly enhanced, like the reductions in blood pressure are better if we're also seeing a robust amount of potassium. And potassium comes from fruits and vegetables and a lot of those plant foods, which are
Hmm.
also typically more restricted in your
Hmm.
keto low carb diet, right? So it's a
Yeah.
bit of a double whammy. It's like you see this extra sodium and just naturally less potassium because the diet just doesn't have these higher potassium items. And we don't supplement with potassium in the same way because it can fairly quickly disrupt things
Yeah.
more meaningfully. Like it's not as safe to play around with. And often there are medications and other scenarios, chronic kidney disease, that you
Yeah.
absolutely can't supplement with potassium. So there's complications to that. They both relate to water retention in different ways. And so, like you were saying, the net carb piece and the conversation around water balance and electrolyte balance and so on relating to should we have more or less sodium or more or less potassium, that's one of the things that changes with estrogen declines in midlife as well.
Hmm. Yeah.
So as estrogen comes down, we tend to become more salt sensitive as a group. So that's where some of that water retention piece can come, but it's also why we see the blood pressure tend to tick up, or it's one of the reasons we see the blood pressure tick up because we are more salt sensitive. We retain more sodium just inherently because the estrogen levels have come down and more sodium retention, more water retention, more blood volume, more blood pressure. And so I do find, and this is where it gets complicated to someone, is trying to manage weight with a particular diet pattern, and the recommendation is to increase sodium, but we're seeing a reduction in estrogen, which leads to more sodium retention. What's happening here that's
Yeah.
going in the positive direction? Not a lot.
Yeah. Absolutely. Thanks so much for adding that. It's interesting because my master thesis was actually in the overconsumption of potassium in a very different context, and it impacting electrolyte balance. So it
Ah,
just kind of like brings me back.
yeah, yeah.
Oh,
I mean, yes, I have lots to
yes.
say about that too, but yeah, so interesting. Yeah.
Yeah, thanks so much for adding that piece as well.
Oh,
And
yeah.
the final piece of the conversation that I was hoping to get into is now, once we establish, I should say that there's a bit of a problem, or if not yet a problem, but just looking preventively as we age, potential options of treatment and care. So I think big picture first, like I would like to maybe for you to share and educate us. What is the difference in approach between starting on the preventive side with working with a naturopathic doctor like yourself versus the more traditional allopathic type of care for the conditions we're talking about?
I mean, I think my answer to that question is probably different than many of my peers.
Love it.
And well, and the reason I say that is because this is an area that I focus on quite a bit. And in the naturopathic space in general, there aren't that many of us who really focus in this area.
Yeah.
It just happened that way. I don't understand it. I love working in this. It's very rewarding. And it's not like it's a rare thing to work with, right? Like it's
Yeah.
a lot of heart disease in the world, unfortunately.
Yes.
Um, but as a result of working in an area that is common and has a huge impact on people's well-being, even though we have to talk about like long-term an understanding of the long-term game, right? Like it's a long game talking about
Yes.
heart health. There's no doubt, which is sometimes frustrating, right? Because you're trying to implement things today that are
Mm.
serving future you, right? And
Yes. Yes.
that's always tough sometimes. Um, but I have become very neutral about the tools that I use. So my goal is as a health provider is to improve your heart health today and tomorrow. And sometimes that means bringing cholesterol down, bringing blood pressure down. Well, not some that often is the case. That's
Hmm.
what we're looking at. And that's the goal. We need to bring those things down. So, depending on the situation, the tools that I'm going to advocate for may find themselves all along a spectrum.
I see.
So, that is, if you had asked little naturopath me of 20 years ago, if that would be the case, that there are some conversations where I'm saying my assessment of the situation is that you should probably consider medication.
Hmm.
Do not pass go. Like that's kind of like there's lots of other things we talk about in terms of supportive tools,
Yeah.
but that is actually my recommendation for your future heart health. And I explain why, because the education piece is really important to me
Yeah.
and informed consent is very important to me.
Hmm.
Um, but that is on the spectrum of tools I will advocate for, although I'm not a prescriber.
Hmm.
However, I also get just as frustrated or just as passionate about the cookie cutter approach of like walking into a doctor's office and if lifestyle and some of the other things are discussed, they're done in a very rubber stamp sort of way of, oh,
Yeah.
these things, your blood pressure's a bit high, your cholesterol's a bit high, go off and change your lifestyle for the next 3 to 6 months. And if it hasn't improved when you come in, well, then you have to go on medication. And
Yeah.
then there's no discussion around the tools to use. There's no understanding of where to spend our energy or some like just practicalities of what to do. And of course, it's like setting people up to fail. So they go back in 3 or 6 months and they're handed a script, which may or may not be the right thing, but no one's been given an opportunity to look at anything else in any practical, concrete way. And
Yeah.
that drives me bananas as well. And
Hmm.
so as a naturopathic doctor, and certainly a lot of my peers will concur with this part, there's so many lifestyle factors levers that we can pull to improve heart health.
Yeah.
There are great evidence-based ways of bringing cholesterol down that don't involve medications. However, if your LDL cholesterol starts at 7, which is very high,
Hmm.
those lifestyle factors don't have the capacity to bring it down to where we need to go, right? So
Right.
those are the conversations. But the tools that we have are phenomenal in lots of different ways. including supporting heart health in general, right? So even if it
Yeah.
doesn't reduce cholesterol, it can reduce the risk of having a heart attack in the future as part of a larger package.
Yeah. Absolutely. And I love that neutrality that you said. And I think very much, I mean, full agreement with how you describe it and positioned it, that it's really looking at the person in front of you, right? Rather than like a category, a box, or just, if this number is high, then this is the solution for it, which is, of course, not the case. But a lot of times, I think that's the frustration with people either not knowing differently or wanting to stay in a more natural route. But also something else I pull out that you said that's really true. And I would say it's very similar in my work with weight management is when we're trying to make decisions today, but really reaping the rewards like down the road, right? So I bring a lot of my human behavior training on that to really, really help link so that we can actually still experience, like I said, rewards in the present moment, knowing that the real big reward is a little bit more future paced, right? And I
Yeah.
think really valuing the preventive side of the work you do is so important because it is so much easier, right, to prevent than to reverse something down the road, especially if somebody wants to stay more within the somewhat natural realm as
Yeah.
well.
Yeah, absolutely. And I think that's true in many different aspects of heart health. And not just the big ones we think about, like having a heart attack or having a stroke. I mean, those are very obvious examples, but
Yeah.
even I'm thinking of something from earlier this week, like atrial fibrillation or different arrhythmias, where there are lifestyle factors and risks associated with that. Once those irregularities happen, I'm not saying everything is lost, but preventing that sort of thing from happening in the first place in someone who may be at more risk is for sure easier than like turning back the clock with any certainty. And
Yeah.
so um it's yeah, the prevention worth an ounce of prevention worth a pound of cure is definitely
Yes.
very true in a lot of these instances, right?
Yeah.
Um but it's talk about the behavior piece. It is we have to be really intentional with those conversations that these are long-term strategies for a reason. And so let's find what works for you.
Yeah,
Mhm.
absolutely. And just, my final question for you before you share how we can find more about the beautiful work you do. Are there any, like maybe a couple of more general tips in terms of somebody just wanting to get started on, preventive strategies, lifestyle, like what would be maybe the most important things to consider?
Yeah, I've got a couple of things there of very different types, right? So
Mhm.
the first, and again, because I work with this all the time, there's this cliche in the cardiovascular world about knowing your numbers. And that usually relates to blood pressure, blood sugar, and cholesterol, all of which have an
Mhm.
impact on heart health. And this is sometimes easier said than done because there are certain things we can't do for ourselves, right? We can't test
Yes.
our own cholesterol, really, but we can test our own blood pressure or measure our own blood pressure. So the thing is, we it's scary, right? Especially things like blood pressure. If we're worried that it's going to be
Mhm.
high, it's almost certainly going to be high because of the stress of worrying that it's going to be high. And
Yeah.
so the again, trying to be really neutral with let's get this information. Let's
Mhm.
do this in a way that gets us the right answer eventually. And so I have scenarios where I help people take blood pressure for weeks on end before we even pay attention to the number so that the number is more accurately reflecting what's going on.
Mhm.
But that can be a bit of a journey. And if it's been a while since you've had any blood work, especially after the last 4 years, then going in and getting that done, it's would be at the top of my list. The knowing the numbers
Mhm.
so that you have something to track
Yeah.
and that we have something to work with, right? It's that tangible information is really, really important. That's the
Yeah.
first thing. The second thing, especially if we're talking about in this midlife time, and if I go back to that statement of estrogen comes down, it is extremely common for blood pressure and cholesterol to go up. And that has nothing to do other than with estrogen coming down. That is not your fault.
Yeah.
Right? So like I'll talk about ditching the shame. Another thing that's way easier to do than that say than do. But I think that there's a feel that changes to blood pressure and cholesterol are something we did wrong, right?
Yeah.
And it's there are scenarios where yes, it may be a reflection of certain types of patterns, eating patterns or whatnot, but even then, it's not like you went out of your way to make that happen, right? And so, but certainly with that midlife change, there's nothing that you could have done about that. Now
Mm-hmm.
we just work with the new state, right?
Yeah.
So I always want people to feel, again, easier said than done. I try and create a space where it's as comfortable as possible to just sit with that with no judgment and no shame, right? And I really want people
Beautiful.
to hear that because that's that's not the case. Like that's not helpful.
Yeah.
Um, and then lastly, completely differently, probably, is one of the things I really harp on as a concept, which brings in all the pieces for heart health, is something that the very conveniently the American Heart Association put together called Life's Essential Eight.
Mm-hmm.
And so Life's Essential Eight is meant to capture many of these things in our day-to-day lives, which can have an impact on heart health. So I will say, like, take stock of these things. And if there's an area which feels wobblier than the other ones, then that's maybe where you spend some energy because we can't do all
Mm-hmm.
things all the time.
Yes.
So if we're going to focus somewhere, maybe we focus on one of these areas that that really seems like the lower hanging fruit, right? So those
Yeah.
life's essential eight, those eight things, there's three tests, which I've already talked about. So the cholesterol levels, the blood pressure, and the blood sugar. So those are a little bit
Mm-hmm.
different. And then we have nutrition, movement, smoking or not smoking, uh, BMI and weight management, and sleep. And the sleep edition is very recent. They just added
Yeah.
that last year. Yeah, which is
Yes,
great because there's a
it
huge
is.
correlation there. Yeah.
Yeah.
And so sometimes people look at me all of a sudden, and by the time I get to sleep, they're like, sleep? And it was like, yeah, sleep. Like, I guess that's what we're starting with.
Yes.
Yeah. Yeah. So that's what I would say. Know your numbers. Please, like, it can feel like you did something wrong for these things to happen. Genetics play a huge role. Midlife estrogen changes play a huge role. Things you can't control often play a huge role. We just sort of have to deal with what's in front of us and
Yeah.
find yourself a space, like a safe space to have those conversations. And that life's essential eight is just like a snapshot of like what are the areas that feel like my low hanging fruit, and I can start chipping away at those.
That's excellent. And those are wonderful resources. I'll put a link to that as well and also your blog post. Thank you so much for this incredible conversation. I was really looking forward to it, and you did such a beautiful job. And I love how
Thank
you
you.
explain things in a way that are very easy to comprehend, but also with the right context so that it actually makes sense in the big picture, honoring the individual as well. And I think that's a beautiful part of your work. So share with us how we can find you, where are the best places online, and so on.
Right. I think where I'm most active, and I'm not always as regular as I would like, but as regular as I can be, I'm trying to commit to being better, is probably on Instagram. So Alex Verge ND on Instagram, also on Facebook,
Mhm.
same Alex Verge ND. I do through that Instagram, and I think you could link to it as well. I
Yes.
have like my three top nutrition
Mhm.
pieces for blood pressure, uh, sort of download. So take a look at that. It's funny because blood pressure was like my original passion. But everyone always wants to talk about cholesterol.
Yes.
And and I think it's for a variety of reasons. But I say that because I decided for my first like a program to put out there to help navigate a particular issue around cardiovascular health for people to manage on their own or learn more about on their own. I chose blood pressure knowing that cholesterol is of greater interest because I think we don't talk about blood pressure enough and we don't talk about the components that we can work with ourselves
Definitely.
and to advocate ourselves. There's actually lots of really important, great information that we benefit from knowing in relation to blood pressure control. And so, despite myself, I was like, No, darn it. I am going to put that out there. So that's not released yet, but we'll link to that as well, whether it's depending on when you're watching this or listening to this, whether it's the coming soon or the actual link to that.
Beautiful. I'll make sure that all the links are clickable in our show notes. Thank you again for your time. Such a pleasure. And cannot wait to share this episode with everyone. Thank you.
Thank you so much, Julian.